Pop quiz. A hospitalized client is receiving lorazepam for acute anxiety. Which nursing intervention has the highest priority? A. Monitor for respiratory depression and sedation. B. Teach the patient about dietary sodium restrictions. C. Encourage daily aerobic exercise. Or D. Discuss the long-term role of benzodiazepines in chronic anxiety management. All right. Let me say this to you before I tell you what the answer is. Even if you had no idea what lorazepam was, you had no idea what the action was, adverse effects, nursing intervention, drug, you know nothing about this drug, but the question's asking you which nursing intervention would be highest priority. As a student, what you're going to do is look for the answer that is the lethalist is not a word, deadliest. I don't know if I can say that on TikTok, but look for the answer that will you the fastest. And when we do that, it would be A, monitor for respiratory depression. Hey, your respirations are supposed to be 12 to 22. 12 is the lowest that it should be, right? You have to breathe and able to live. So you're going to monitor for respiratory depression and sedation. That will you the fastest more than anything out of this group. Let's look at our answer choices. B, teach. Stop right there. Let me tell you something. Teaching has never a patient. If you're being asked about a priority, that means it's something that's going to save that patient's life. Teaching can happen later. Teaching, emotions, we worry about that stuff later. What we care about right now is your physiological integrity. What's keeping you alive? Regulation of the blood pressure, the heart rate, the respirations, the temperature, the glucose, the fluid and electrolytes. What is keeping you alive? The hemodynamic status, right? That is what we care about first. So stop right there. The minute I saw teach, nope. C, encourage daily aerobic exercise. Well, that's great for a patient that has anxiety, but is that going to keep them alive? No. And then last, discuss long term. Let me tell you something. When you have a question asking you about priority, it's about what we need to do right now to keep that patient alive. So anything that's chronic or long term can wait. We care about the here and now. So these are little tips and tricks I want you to use if you don't know what the answer is to still figure out what the correct answer should be.